and today I'm gonna talk about the types of pelvic shapes. The types of pelvic shape. Guys, I'm not gonna upload images over here. I will try my level best to explain you. Okay, so you know the bones that helps in the formation of the pelvis is ilium, okay, ischium, pubis, sacrum, and coccyx, SNC. Okay, so the ilium forms a superior laterally, ischium inferior laterally, pubis anteriorly, and sacrum and coccyx posteriorly. So if I have to draw a diagram, I don't know. Okay. All right, guys. So this is what the pelvic inlet or pelvis is formed. So it's formed by the four important bones: ilium, ischium, pubis, and sacrum and the coccyx. Right. So the types of pelvis, we have a different types. As we know, the gynecoid. Then we have android. Not the Android or iOS, guys. Windows, Android, iOS, okay, and anthropoid. Then we have platyploid. Platypeloid. Okay, guys. So let's talk about the gynecoid. So remember the gynecoid. Okay, the gynecoid is it's a classic female pelvis, and it's found in 50% of women. Okay, and the inlet is the shape of the inlet in this gynecoid is oval with the largest diameter being transverse. Okay, and it is the shape is a round oval. Just google the images, guys, and typically it shows a round image. Okay, so it will be like this. Inlet will be like this. Okay, typically oval. It should be oval, sorry. Okay, like this, right? So it has a straight side walls and well curved sacrum. Okay, and very spacious subpubic arch with a 90-degree. Okay, with a 90-degree, and it's really very spacious and for the fetal head to pass through. So you will not get any complications or during the delivery of most of the time during delivery through this gynecoid shape. Now let's talk about the android. The android shape is typically what you call a male pelvis, okay, and it's found in 30% of women, okay, 30% of the women. And the inlet is the shape of the inlet in android is triangular. If this is like this, okay, not exactly the triangle. If this is a sacrum posterior, okay, sacrum and a cervix, okay. Remember, and this is what you call android shape looks like. Okay, and the inlet is a triangular and convergent sides as we have described in the figure. Okay, and shallow sacral curve and narrow pubic arch. Look at this, the narrow pubic arch, really very important. Okay, the narrow pubic arch, the right this pelvis is restricted at at all the levels, and arrest of the descent in labor is common with this android type of pelvis. In anthropoid, let me draw the anthropoid. The pelvis resembles that of anthropoid apes and is found in 20% of the women. 20% of the women, and the inlet is what called large anterior posteriorly with the side walls that converge. So if I have to draw like this, and this will be, it's like a narrow oval, you can say, right? So the inlet is large anterior posteriorly with the side walls that converge. Okay, so inlet is large like this. Okay, the subpubic arch is narrow. Remember, the subpubic arch is narrow. Okay, the subpubic arch is narrow. The assessment regarding this anthropoid shape is the fetal head engages anterior posteriorly. Anterior posteriorly. This is posterior, this is anteriorly. This gets engaged in this and often in occipit posterior position, making delivery very difficult. So remember this. Okay, so this is really very important about what you call anthropoid shape of what you call pelvis, right? So we have another type, that is platypeloid shape. Platypeloid, this is like a flattened ganocoid. It means this, the shape will be like this. Just I'm gonna drawing like that. Okay, flattened ganocoid you can say. And the inlet is an elongated transverse oval diameter. Okay, it has a straight side walls with a deep sacral curve and a wide subpubic arch. So remember, subpubic arch is very wide. Okay, and the fetal head engages transversely and delivers occipit transverse position. Delivers occipit transverse position. Okay, OTP, remember, occipit transverse position. Okay guys, so regarding the shape, this is regarding the pelvis shape and the basic idea about the pelvic shapes. Okay, so thank you so much for watching this video. Take care.